Do you know what the most common chromosomal disorder is? Today, I'm going to inform you about a chromosomal disorder called Down syndrome. I've done research about Down syndrome and some of the interesting things about it. Today, I'll describe Down syndrome, some of the characteristics and effects of it, and who introduced it. I would like to begin discussing who founded Down syndrome. John Langdon Down was a British physician in 1866 and was the first person to describe Down syndrome. Down syndrome was called Mongolism until the 1970s. Back then, they did not believe in people keeping their kids that were born with a birth defect. The doctors back then would tell the families that the child with Mongolism that they were less than human and their needs would be too much to handle and care for. When someone had a child that was born with a birth defect, they tried and encouraged the family to send them away. They were warehoused into a large state institution, and they locked them away so that society did not see the horror in their lives. Kay McGee began reaching out to other parents that had children with Down syndrome and professionals to help start an organization. Kay McGee founded NADS in 1960 after giving birth to her daughter that had Down syndrome. According to NADS, Kay organized regular meetings for parents in downtown Chicago, bringing in speakers as far away as Germany. Not only did the parents along with Kay get an organization going, but they also fought very hard for early intervention and education services locally and nationally. Some doctors would give orders to the nurses not to feed the babies and to starve them to death. Eventually, Kay and Marjorie Lee, who Kay described as the most knowledgeable and involved parent there was, would visit the hospitals, and when the baby with Down syndrome was born, the nurses would get them so that they could support and comfort the family as needed. Now I will begin discussing what Down syndrome is and how they diagnose it. Down syndrome is a chromosomal disorder. Everyone has 23 pairs of chromosomes. A kid that is born with Down syndrome has 23 also, but chromosome 21 has an extra copy. So here's all your chromosomes. This is chromosome 21, and as you can see, has an extra copy. So all these have 2, and this has 3. So this is what causes Down syndrome. According to Mayo Clinic, the extra copy of chromosome 21 causes developmental changes and physical features. It is not inherited from one or the other parent. It is a common mistake in a cell division that did not divide right during the initial stages of the fetus. Down syndrome is normally diagnosed before or at birth. When you are pregnant, they run multiple tests to figure out if your baby has any complications that the doctors need to know about. Most cases are caught instantly due to an ultrasound. According to UCSF Health, a baby that has fluid at the back of its neck sometimes indicates Down syndrome, which then would encourage further testing to be sure. There are 2 other ways to find out if your baby has Down syndrome. The most common one is amniocentesis, which they will shove a needle through your abdomen and remove a small amount of the amniotic fluid. It is normally performed between 15 and 20 weeks, which is about 4.5 months of pregnancy. Now I'm going to show you a video of how they perform amniocentesis.
Carefully watching the ultrasound monitor to avoid contact with the placenta or the baby. Your doctor will introduce the thin needle through your abdominal wall into your uterus and into the amniotic sac. He or she will then withdraw a small sample of amniotic fluid, remove the needle, and cover the site with a bandage. Your body will make additional fluid to replace what was removed.
So after they pull the fluid out, they will send it to a lab and they will run it with a normal amniotic fluid compared to what the amniotic fluid is like with a baby that has Down syndrome. The last type of testing is known as CVS, chronic villus sampling. The main advantage of CVS compared to amniocentesis is that it is done earlier. It's done at 10 to 12 weeks, about 3 months of pregnancy. The disadvantage of it, though, is that it cannot detect spinal cord defects. And there's a small risk, 1 in 100, of having a miscarriage after this procedure is performed. Now I will begin talking about some of the risks and effects of Down syndrome. Most babies that are born with Down syndrome have a variety of complications, and some can be life-threatening. Each person diagnosed is different. Intellectually and developmental problems can be mild, moderate, or severe. Most people that have Down syndrome also had or have some health problems or complication when they are born. The most common health problem that they are born with is a congenital heart defect, AVSD, atrial or ventricular septal defect, which is a large hole in the heart that must be fixed by open heart surgery as soon as they are born. Another well-known problem is gastrointestinal GI defect, which is abnormalities of the intestine, esophagus, trachea, and anus. According to Global Down Syndrome, researchers show that people with Down syndrome tend to be obese due to a thyroid and lower metabolic rate, which means that they burn fewer calories overall compared to a typical child. A fun fact is people with Down syndrome cannot tell when they are full. So when you eat food, you can tell that you're full, but kids that have Down syndrome cannot tell. The physical characteristics of a person with Down syndrome vary from the typical person. When you look at the palm of your hand, how many creases do you have? 3, right? One of the easiest ways to tell if you meet someone that has Down syndrome is by their hands. As you can tell, he only has 1 crease, which is right there. But we have 3. Their hands are small, their fingers are short and webbed. You can also tell their fingers are short. When you look at their face is flattened. This is me with a kid that I know that has Down syndrome. He has smaller ears, his neck is shorter, he's overweight, his face is flattened, his eyes are upward. That's the physical features of a kid with Down syndrome. Their growth is also delayed, so I'm sitting down, but if I were to stand up, he would come up to like my belly, which he's 13, so he's a lot shorter than what an average 13-year-old kid is. I would like to leave you with the following information. I have informed you about what Down syndrome is, who introduced Down syndrome, and some of the interesting characteristics and effects of it. I hope you understand Down syndrome a little bit more after my speech and enjoyed some of the interesting things that come along with it. Hopefully the next time you encounter a person with Down syndrome, you will be more understanding of the person that they are and know a little bit about why. Thank you.